HIV symptoms in men, common and early symptoms. While most are aware of common STD symptoms like gonorrhea, chlamydia, and herpes, few know of HIV symptoms in men. Gay, bisexual and MSM, men who have sex with men, are the population severely affected by HIV. According to CDC, young gay and bisexual men between 13 and 24 accounted for about 72% of new infections among all people with HIV in 2010. Further statistics shows the group accounted for 30% of new HIV infections among gay and bisexual men. In 2010, statistics showed 56%, 489,121, of people diagnosed and living with HIV in the United States were gay, bisexual and MSM or gay, bisexual and MSM who also inject drugs. By the end of 2010, the CDC estimated about 302,148 gay and bisexual men with AIDS had died in the United States since the epidemic. This accounted for 48% deaths of all people with AIDS. Other men -22% Hispanic and Latinos, 35% whites, and 39% blacks, accounted for new HIV infections among men by the end of 2010. Among females, new HIV infections decreased from 12,000 to 9,500 in 2010. Comparing the numbers, the rate of new HIV infections in men was 4.2 times that of females. What is the difference between HIV and AIDS? HIV, which stands for Human Immunodeficiency Virus, is a virus that affects and gradually damages the immune system until it cannot fight infections. After the initial exposure, infection, the most common of HIV symptoms in men and women is a brief period of flu-like illness followed by a long asymptomatic period, no symptoms. On progression, the virus makes the person more susceptible to infections like pneumonia, tuberculosis, tumors and other opportunistic infections. These infections are less common in people with healthy immune systems. Most health centers offer free HIV testing for people with tuberculosis since TB is an opportunistic disease that preys on weakened immune. Late symptoms of HIV are known as AIDS, which stands for Acquired Immune Deficiency Syndrome. Symptoms of AIDS in men and women during this stage are severe weight loss, pneumocystis pneumonia and a cancer type called Kaposi's sarcoma. Early HIV symptoms in men. Influenza-like symptoms. Those who get the infection experience early symptoms of HIV that mimic the flu within 2 weeks to 3 months after initial infection. It means that they experience high fever for 1 or 2 weeks with these symptoms. A sore throat, mouth and genital ulcers. A cough and shortness of breath. Severe headaches, swollen lymph nodes, night sweats. Nausea and vomiting, diarrhea. Muscle and joint pains. Rash on the face, arms, legs and belly. Blurred or distorted vision. Chronic fatigue. Some people will not experience flu-like symptoms after initial infection, that's why it's important to go for regular HIV testing. One may feel healthy after infection for about 3 years to over 20 years, 8 years being the average. This stage is called asymptomatic HIV, chronic HIV or clinical latency. Challenges in preventing HIV in gay and bisexual men. Risky sexual behaviors. The common mode of HIV transmission among gay and bisexual is anal sex. Anal sex is the riskiest type of sex for transmitting or getting HIV compared to vaginal sex. In addition, condoms break more often while having anal sex, increasing the risk for infection. Use of condoms and antiretroviral medications may prevent getting or transmitting HIV virus among sexually active gay and bisexual men. Gay and bisexual men also have high risks for other sexually transmitted diseases like gonorrhea, syphilis, and chlamydia. More sex opportunities and partners. Gay and bisexual men have more sex opportunities compared with other men. Meaning, they are likely to have sex with men who can transmit HIV or other STDs. In addition, most gay men have multiple partners, increasing their risk for getting HIV. Unaware of their HIV status, most gay and bisexual men with HIV are unaware they have the infection. although statistics shows the number of those aware of their status increased from 56% in 2008 to 66% in 2011, more gay and bisexual men don't know their HIV status. Only 49% of gay and bisexual men between 18 and 24 years and 76% aged 40 and above knew they are HIV positive. 86% of white gay and bisexual men are aware of their status compared with 63% of Hispanic and Latino and 44% Black and African American gay and bisexual men. Those unaware of their HIV statuses do not get medications they need to help the immune system and may infect others unknowingly. To know if you have HIV, test 3 to 6 months or at least once a year. Stigma and discrimination, homophobia, these puts gay, bisexual and MSM men at risk for physical and mental problems because they affect their decision to seek and obtain quality healthcare services. Can you get HIV from kissing and oral sex? It is rare to get HIV from kissing because it is not spread through saliva. However, if an HIV-infected person has bleeding gums or mouth ulcers, infected blood can be exchanged through deep, open-mouth kissing. If bitten by a person with HIV, chances of getting an infection are low unless the skin breaks and the person has bleeding gums. It is also rare to get HIV from oral sex on a man, fellatio, compared with vaginal or anal sex. However, if your mouth has cuts, bruises or sores, the virus can enter your bloodstream through these paths. Also, HIV virus can infect the lining of the mouth. Just as with swallowing venom, swallowed semen is digested by the esophageal enzymes and stomach acids, killing HIV virus. Your risk for infection is high if semen remains in the mouth for long. Therefore, spitting semen after oral sex may reduce the risk for contracting HIV. In addition, giving cunnilingus, oral sex on a woman, rarely transmits HIV. The vagina is a mucous membrane, meaning it can also transmit HIV. However, the recipient, woman receiving cunnilingus, is likely to spread HIV during her periods because blood carries the virus. HIV virus cannot be spread through rimming, or anal sex. Experts believe that a rim job is a safer sexual practice in terms of HIV infection. However, it is clinically possible to transmit HIV, for instance, through openings of ruptured hemorrhoids, anal fissures or oral